Okay, so for the first part, I'll be seeking consent for 4 things. So basically, the pre-participation screening, which is a health questionnaire, uh, consent for the balance test, the cardio assessment, as well as exercise prescription. So firstly, for the pre-participation screening, is to check if you need medical clearance before any activities. Check what exercise intensity from light, moderate to vigorous you wish to exercise at, and whether you have underlying health symptoms and conditions. So let's say if you're cleared, then we can continue with the balance test and the cardio assessment. So throughout these assessments, right, I'll be able to make better exercise prescription choices so that I can get you closer to hitting your fitness goals. So I'll also share with you benefits and risks of these exercises, as well as safety precautions and indicators for termination. Let's say if you're not feeling well, you can stop at any point that you want. So these activities will also include sporting. So through sporting, my hands will be near you to make sure I provide support in case any accidents happens, like you lose balance, and yeah. So if you have any questions, you also can feel free to ask me at any point in time. So are you okay with that? Okay, so next I'll be going through you the 2022 PARQ Plus form. So has your doctor ever said that you have a heart condition or high blood pressure? Do you feel pain in your chest during activities of living or when you do physical activity?
No.
Do you lose balance or dizziness, or have you lost consciousness in the past 12 months?
No.
Have you ever been diagnosed with a chronic medical condition other than heart disease or high blood pressure, if you have any?
No.
Are you currently taking any prescribed medication for any chronic medical condition?
No.
Do you currently have, or in the last 12 months have had, any bone or soft tissue, muscle, ligament or tendon problem that can be made worse through physical activity?
No.
So has the doctor ever said that you need to be medically supervised during activity?
No.
Okay. So can you please sign at this part of the PARQ 2022 form? Yeah. So since you said no for question 2 and 3, we do not have to do the next page of the PARQ Plus form. So on the last page you have to sign again over here for participant declaration. Okay, nice. So now I'm going to be asking you whether you have any of these signs and symptoms of cardiovascular, metabolic or renal diseases. You can look through the list to tell me if you have any. Okay, so now I'm going to ask you, which exercise intensity do you wish to train at?
Vigorous.
Yeah. Okay, next I'll be checking you against the ACSM pre-participation screening algorithm. So there's actually 2 charts, but since you're a person who participates in exercise regularly, will be using this one. So since you have no CV, metabolic or renal disease, and no signs or symptoms of any of these diseases, no medical clearance is necessary, and we can continue with the current exercise volume / intensity or progress as appropriate. So before we participate in any of these assessments and tests, what we need to take note is on the day of the assessments, there should be no alcohol, no caffeine, as well as no food within 3 hours of the assessment, as well as no tobacco like smoking before any of these assessments.